of surreal, honestly, over the last couple of years.
Awesome.
Yeah.
Sorry, I was just doing the Facebook Live before I forgot. Okay. So another question, what was your journey like as someone who is neurodivergent? Did you have any particular struggles or strengths?
Yeah, it's a good question. Lots of struggles, lots of strengths, kind of both existing at the same time. I've always known and felt that I was pretty different. I didn't have a lot of friendships growing up, had a hard time making friends, had a lot of interesting hobbies and special interests. I can think of a few that I was having a conversation on my TikTok channel about. I always remember doing really well in certain subjects and also really struggling with certain things and also really struggling to pick up on social cues. I played soccer growing up, so that helped quite a bit because I didn't have to talk to people. I can just go out and be active. But, going through life, that felt really challenging in a lot of ways. There's a lot of loneliness and like questioning your own existence a lot of the time, like feeling very lonely, feeling disconnected, like what is wrong with me? I can't figure this out. Sorry. And then just really, having a lot of those thoughts throughout most of my life. Had a gambling addiction for a lot of my life. Worked through that and through a lot of mental health work and just getting better understanding of like who I am and how I move through the world. Got diagnosed with ADHD like 6-7 years ago. It kind of made sense to me, bouncing from thing to thing, always being interested in different things, losing interest in things, being really impulsive. Never really thought about being autistic. And then the more and more I learned about neurodiversity and just continued to struggle socially, always struggling, even if people were around me talking about how they care about me, how they love me, how, etc. And I'm sitting there like, I can't take this in. I don't feel it. It doesn't, there's something off here. And I just couldn't make sense of it. So more testing, got diagnosed autistic about 6-7 months ago. And I think there was a grief and shame process around that. I had this association, as I think a lot of people do, with autism and just really not feeling like this is my experience, and having to also think about as a child and a teenager and a young adult how much different life could have been had I have known, had my parents have known. Maybe that wouldn't have changed anything, but that thought definitely went through my head quite a bit. But and I also want to name, like, in all of this, my privilege, because I've been able to unmask a lot more easily than a lot of people can. And just being a mental health therapist and a cis het white man, like, I have a lot of privilege to do so. And it's been kind of honestly freeing. I just think that is the word that comes to mind when I think about embracing being an autistic person, therapist, entrepreneur, all the things. Like, to be able to talk about it openly and just share experience has been kind of what I've always aimed to do in terms of destigmatizing not only mental health and addiction, but now the struggles that people with any sort of neurodiversity have. And I'm still learning all the time, like using the incorrect terminology for a very long time because I didn't fucking know. Sorry, I shouldn't have cursed. That's my brand. I'll apologize now and I will rein it in. But, I just didn't know. And I think learning and just asking questions and being curious, reading, and using a lot of resources that are out there, I think really important. And there's still a long way to go, but it's been an interesting journey. I can say that. And I feel like ever since that diagnosis, life has really started to make sense. And I think that's the first time in my life that anything has really felt clear. And there's still people who are very dismissive about it, as I'm sure some of you have experienced. People will tell me I'm too high functioning to be autistic and I'm too successful. And I have a master's and own multiple businesses and look very put together on the outside. But think a lot of people don't see the other side of what exists, and the depletion and the energy absorption and the stimulation and the difficulty still in relationships all the time. The loneliness is real. It exists constantly. But I think now it's a different type of loneliness where I know it exists, I can feel it, but rationally I can think like, but I do know these people care about me. I just still can't always access that. So it's just been an interesting year, to say the least.
Yeah. Yeah, definitely. I think we can all relate. Well, at least the people who are also neurodivergent here or autistic can relate on a lot of what you were saying. Um, One question kind of coming off of that um, is your practice at all focused on like neurodivergent individuals? Like, and were you focused on them before or after? Like, have you changed your practice and how you view things based on your autism diagnosis?
Yeah, that's a great question. I wouldn't say that we were explicitly neurodiversity affirmative in terms of like really focusing in on people who were neurodivergent. I think we were probably more focused on harm reduction because, and we still are, because we focus on childhood and attachment trauma for the most part, but now the recognition that most neurodivergent people have experienced significant amounts of trauma. Um, there's such a correlation, and most of our therapists are neurodivergent. So we have really worked hard, and we still have a ton of work to do collectively to become as affirmative as possible. And there are still a ways to go. Um, but ultimately, it is a focal point now, and it's going to be a focal point going forward. And just really making sure that we are as equipped to support people with any sort of neurodiversity as possible. And that there's a whole slew of things that go into that. But ultimately, if our clients want to have special interests and talk about special interests for an hour, who cares? Like, in my mind, that's therapy. And we always need to make sure that we have sensory toys. Like, I'm always squeezing something, right? Like, we always want to make sure to have really dim lights. We want to make sure that we are really trying as hard as we can to reduce all sorts of ableism that exists in the world, in a neurotypical world where a lot of people feel like they just don't belong or fit in. So, that is definitely our focal point going forward. But I will say it's shifted since my own experiences, because I think that is who I am. Like, when I am passionate about something, I'm all in on it. And I'm sure a lot of you can relate on that too. But that is just how I've lived my entire life. So now, kind of the rest of wherever this goes, that will be a big focal point for my energy for sure.
Mhm. And going off of this kind of also, could you tell us how you like treat autism or ADHD in therapy? Like, do you look for co-occurring conditions, or do you have like a certain type of therapy, I guess, for neurodivergent people?
It's a great question. I mean, I don't think we necessarily practice a certain type of therapy for the folks that are neurodivergent, aside from having as much awareness and affirmation as possible. Like, we will refer out if the client wants psychological testing to get a really concrete diagnosis, but we also believe in self-diagnosis. So if our clients really feel like, I don't want to go down the psychological evaluation route, point them in the direction of some resources for self-diagnosis and evaluation. And not everyone has the resources to do diagnostic testing either. And it can also be really harmful depending on the psychologist if they don't have enough knowledge about neurodivergence and neurodiversity. But ultimately, what we really are trying to do is meet people where they're at and just hear their stories and their experiences and just honor what they need. And again, like, we're not behavioral based, we're not cognitive behavioral based. We are certainly anti-ABA. And a lot of our work is going to be basically honoring the way that the brain works differently, providing psychoeducation for people who still are questioning things like, why do I do A, B, and C? Why is this how I experience the world? But I also want to name that you need a ton of training to be able to accurately diagnose autism. And even ADHD. There is so much testing involved to really parse that out in a clinical setting. So I really don't want to misrepresent what we do as clinicians, because I think there's still so much learning about the brain and the way the brain works in general. So I just want to say that, because I don't want to misrepresent who we are either. I think just really acknowledging and learning, doing trainings with autistic and ADHD and neurodivergent trainers and consultants is also really important. Taking continuing education for the same things. I mean, it's got to be constant. And that's the same if you're going to be doing anti-racist training and LGBTQIA plus training. Like, it's got to be constant. And it can't just be, naming the name and talking the talk. You've got to walk the walk too. So it's just an evolutionary process. Griffin, you got your hand up, I think.
Yeah, so you mentioned about cognitive behavioral therapy. We had the opportunity to interview Kevin Schindewolf a couple months back, who is a therapist that works with many neurodivergent individuals, or at least these patients are neurodivergent. And he uses CBT, cognitive behavioral therapy. So I was curious to know, is there still any value, or is it still useful for anyone who is autistic and is dealing with depression and anxiety? Or do you feel like there's other different alternative methods that are far better than CBT?
Yeah, that's a great question. CBT is all thought-based, right, and cognitive-based. So our thoughts lead to emotions, which lead to behaviors. I'm not going to knock it. I mean, it's a gold standard for so many people, although I still think it's kind of based in white supremacy in some ways, because most of the research is done on young white men. It doesn't take a lot of culture into consideration. Yeah, Leah, I agree that DBT is helpful. So I think we have to take into consideration all of the research that's out there in terms of how to work with neurodiverse clients. And I wouldn't always say that CBT is the gold standard in general. I mean, we've got to take into account the fact that the brain is neurodevelopmentally different. We need to talk about the fact that there are different indications in terms of how people socialize and how they absorb energy, the way that the brain is functioning minute by minute in all situations. Environmentally, we have to take into account everything. And CBT isn't always useful, but that doesn't mean that it's not useful either. We don't want to use these like binary statements or black and white statements either. One thing we know about working with people with neurodiversity is being sick and my brain feeling really foggy right now. Disclosure, the power of disclosure is so important in the therapeutic setting. Because if I can disclose as a therapist that I'm autistic and ADHD, the odds of my client feeling much more safe and connected and grounded and comfortable to share their experiences and to truly unmask, that can be really, really some of the best therapy that we can offer. The ability to have someone unmask in a safe situation and really, if they want to stim, they can stim, giving them permission to move around the room, like pacing if that feels useful. Using tactile and sensory toys to ground and regulate, being able to talk about special interests without shamefulness, because I think so often we associate therapy with looking one certain type of way. And I would say that is not really conducive for people with neurodiversity. That feels much more like neurotypical therapy if we have to say, like, we have to hit certain milestones in therapy. We have to be goal-oriented all the time. We have to really talk about like certain specific steps to get there. Sometimes people just need to come in and feel safe enough to be heard, validated, reinforced, and supported. And I think we lose sight over that a lot of the time. And I also think a big part of therapy is the relationship. Like the rapport that's built in the room is a big indicator of success in therapy. And we lose sight of that too, with the fact that like if we're always constantly striving to hit this next goal, this next milestone that we're creating because the insurance company says we have to, really lose sight over the fact that at the end of the day, the relationship is the biggest indication of success. I don't know if that answered your question, and it felt really long-winded, but I just want to say that it really can't be black and white in a situation when we're working with human beings. And I think we have to take into account our own biases too that come up when we are working with anyone, especially neurodiverse clients. Even as a neurodiverse client therapist myself, I still have biases that I need to work through. And if your therapist isn't willing to do the work, then that's very, very problematic.
No, I appreciate you taking the time to answer my question. It's always good to kind of, if need be, rewatch this. But no, I think you gave some very informative answers that I had not had heard about or had considered, because no, CBT has been used quite often. But no, thank you.
Yeah, of course.
I just want to stop to ask if anyone else has any questions they want to ask at this point.
Yeah, please do. I love interaction. If y'all couldn't tell that already, but I love kind of having these types of discussions. So if anyone has anything at all, I'm happy to talk about it. How big is my definition of neurodiversity? Oh, wow. That's a great question, Leah. It's big because if we're going to define it as any sort of way that the brain has diverged from a typical route, we can include anxiety, we can include all sorts of trauma, dyslexia, schizophrenia, bipolar disorder, like the list can go on and on and on. And I think that the big three that we constantly talk about are autism, ADHD, and dyslexia. And those are neurodevelopmental conditions, right, and disorders. Whereas someone with anxiety, that is a mental health condition that gets that shifts throughout life and develops throughout life. So they are very different when we're talking about neurodevelopmental and just mental health conditions. And, you know, we probably have all heard, well, everyone could be considered neurodiverse. Well, maybe to some degree in some instances, if we're really defining it that broadly. But ultimately, if we are defining it as neurodevelopmental, then no, you certainly would not fall under that umbrella. So I think there's differentiation there too. But that's a great question. And I think everyone has their own definition of that, which is really interesting to kind of see in the therapy world, even different definitions of neurodiversity.
Yeah, I've been thinking about that for a few years already. Like, what exactly is neurodiversity? You know, it's you know, because I'm trans and some people are non-binary, and it seems like there's a lot of people that fall into that as well. You know, that's like it's a higher percentage like when you start looking at stuff like that. So it's just like for me, it just keeps on getting bigger and bigger, not smaller. You know,
Sure.
it seems like the whole freaking DSM, you know, could be almost in it. So at this point, but
that's a good point. And I think that also leads to a lot of misdiagnosis. If we have so much overlap in how certain diagnoses look, like ADHD and autism get misdiagnosed all the time, and are often comorbid with one another, where both exist simultaneously. And autism gets misdiagnosed as personality disorder and mood disorder. It's so complicated. That's why having people who are really well versed in this stuff really important, because it can be damaging otherwise. And you know, trans people and people of color specifically are going to get misdiagnosed way more often than people who are just white men in general. Like cishet white men are the stereotypical ADHDers, right? And like the autistic children. So it's so complicated. It's so layered. And I appreciate you naming that.
yeah, I mean, I had diagnosis of bipolar 2, like anxiety disorder, you know, possibly personality disorder, you know, borderline, things of that sort, you know, until kind of figured out at the age of 69 that it's probably all under autism, and gender identity as well.
Right.
And it's probably all under, it seems like it's all under the autism. And also, I think most people here that I know are super high functioning. So you don't have to worry about being in a group of, like, being high functioning. That seems to be typical as well for a group of people that are autistic, especially. So They're super high functioning, some people. With all the garbage on the other side. Emotional, it's not garbage, the emotional stuff. I'll be quiet now.
No, you're okay.
No, it's great points. Great points. Stuff to talk about. And can I ask you a question of, like, after all that experience, finally learning this at 69, was that relieving at all, or how was that for you to just?
Same as it was for you. It was like,
Yeah.
it's like the light went off. I made a documentary of, people that are older, over 50, that are kind of wakening up. I have a small support group, that exists, for people over 50, that's like, what's been going on? It's like, I've been living my life, for quite a while, and I don't exactly understand why things are what they are, and it's, and kind of like exploring that for older people, who didn't have any, have, had nothing growing up in terms of support or even understanding what this was, and we somehow found a way to kind of exist. But now it's sort of like an awakening. It's like most people that I look at say, wow, now it all makes sense.
Yeah.
Like now this all makes sense. It's like, oh, this is what the heck it is. So that's my experience.
Thank you for sharing that.
Yeah.
Yep. Thank you for sharing. I guess maybe we could the word high functioning and what you think about that, Patrick. What do you think about when people use that word?
I struggle with that word, because it depends on how we're defining it, right? Like, if we're defining it based in a neurotypical way and through an ableist viewpoint, I'm very high functioning of, like, I have a job, I make money, I do A, B, and C. I own a business, like, I have a master's degree. Like, those are all indicators of success and accomplishment and a quote unquote normal achievement in this country. And if we're only gauging functioning by accomplishment, that's really problematic, because we have to think about adaptation too, right? For people who maybe aren't able to communicate verbally, we might classify folks as low functioning, but if they have the appropriate adaptation and intervention, they can do unbelievable things with the way that their brain actually operates. It's just that if we don't give the appropriate tool, then of course society is going to say, well, this person's not functioning, and vice versa. And high functioning, right? Like, again, if we come back to, like, what goes on behind the imagery on social media, or what people think from the outside looking in, is there anyone that sees any of you crashing for days at a time after you show up and go to school or socialize? Or are they seeing meltdowns and shutdowns outside of quote unquote everyday life? Are they seeing you repeatedly watch the same things over and over and over and over and over? Trust me, Hobbit behind me, watch Game of Thrones endlessly, turn it off at season 8. But I think that we don't always see the fact that, like, this overwhelming sensory overload from any sort of social situation or going out to the grocery store, all of these adaptations that have to be put in place in order for us to move through the world in a way that we can self-preserve, right? And, like, preserve our energy. And going to a wedding may mean you have to be in bed for 2 weeks. Like, these are the things that people don't see. They don't see the autistic burnout and the depression and the suicidality and all of the stuff that comes with feeling like you don't belong as a part of this world, or that you can't function the way other people can function. It's and they are terms that get thrown out a lot. And I'll be honest, I was one of those people who threw that term out constantly. And even when I got the autistic diagnosis, again, I was like, not me. Like, I have A, B, and C. Like, this is, and now looking at it, I'm like, holy shit. Like, this all makes a lot of sense. But I don't love the labeling. And we hear it so often. I mean, I saw, Leah nodding your head over there. Like, we hear it all the time. And again, we just don't see the behind the scenes piece if we're not willing to talk about it. We often can't talk about it because then we're weird, or we're like victims, or we are just being needy, or we're, bringing too much attention to ourselves, or we're just like acting out, or we're being different. There's so many things that come with actually talking about how you're experiencing your day to day. And that can come with a significant cost and risk as well.
Yeah.
I will say
Yeah.
too.
Sorry.
My bad.
No, you can go.
No, go for it.
I will say too. I'm still right now. I'm still working on episodes of my podcast, but when I was going through sources, there's still data that's published by a National Institute of Health. That any article they publish still uses those terminologies, but they most of the sources are used it for intellectual purposes, but intellectual disability is not as common with ASD. And on top of that, the thing to also keep in mind too is what is the social aspects of high functioning and low functioning. If you were to describe someone as low functioning, I think you undermine the success, achievements, things that these people can do. And if you used high functioning, you are undermining, as you already mentioned, you don't see what problems they deal with, or what they have to go through on a daily basis. And on top of that, some people still use outdated sources. To use an example as a movie, there's still some comedians that still reference Rain Man to this day, which is like 40 some odd years ago. But I do find it, I say interesting mildly, because I think it's important to change these labels. I understand the significance of labels in the sense of trying to understand what you're looking at. But at the same time, I feel like there needs to be updated information and understanding, and why these terminologies, as you've already mentioned before, are not great to use and are outdated. And I think that's something to also consider, is the social aspects. Not that I had a question, but rather I really wanted to kind of chime in on that, because I think it's very important for anyone watching on Facebook Live, or on Zoom, or watching this later, to consider why these terminologies are not beneficial at all, and actually a hindrance to our understanding of neurodiversity. So that's my soap opera right there.
It's a great point, and I appreciate you naming that. That's a really, really great point.
Yeah, when I was mentioning high functioning, I think also I was kind of suggesting that I know that some of the people here are activists to some degree in the community, and are out there trying to promote change and discussion and things of that sort. So it's different from other people. It's just what people are doing. Some people are, I was an engineer, and I've done all the things of the world, neurotypical world thinks I'm successful, and other people look at me, think I'm just a disaster, emotionally, and things of that sort. So, from the neurotypical explanation. So,
that's a great point too.
Yeah.
And, autism, giftedness, right? Like, there's a lot of high acuity and intelligence there. But again, it's about how does the day-to-day world perceive you, and the perception of how you move through the world is quite skewed when we're only using certain benchmarks to measure quote unquote success or lack of success. Shayna, you've got your hand up too. I'm sorry, Leah.
That's okay.
Yes. Sort of interested. I'm a late figure out. I'm in my 60s and have figured out in the last year or so that I am on the autism on the autism and maybe also ADHD. I'm still figuring it out. I'm self-diagnosed. But sort of as I'm looking back over my past existence, and a lot makes sense to me now, viewing myself through these lenses. And one of the things that I'm really interested in figuring out, because I suppose I would fall into the, the high functioning, and I don't like the terminology either, but I'm interested in figuring out for myself, like, obviously I was really good at masking, and I'm also trans and non-binary. So I learned to mask a whole lot of things for a long time. Came out as trans about 30 years ago, but so I'm interested in the different ways that we mask as non-binary people, as trans people, as women, because there is that stereotype of the white cis male way of being autistic. And then the other part is I'm kind of trying to explore, like, okay, so what might I have done as a kid to STEM? Or what might I find now as the 66-year-old? That what are my stints? Because I hid them from the world and thus also from myself. And I'm not just speaking about myself here. I think this is the case for anybody that is diagnosed later in their life. I mean, and whether that is at 20 or at 40. So I'm just interested in your thoughts about that. Thanks.
Yeah, you're welcome. And thank you for asking that. I don't want to keep using the same answer of this is so complicated, but it is. And I think that growing up, dependent on gender, dependent on identity, dependent on how society says you're supposed to interact, right? Like, for a quote unquote example, for someone who's female identifying, growing up, you may show certain interests that you're not really interested in so that you can fit in social situations. You may be talking about like dating certain boys in school. You may be talking about certain TV shows or like acting a certain way so that you don't stand out. And I think it's all about, again, not standing out to not draw attention upon ourselves in terms of any sort of way of being bullied, discriminated against, being told that you're weird, different, why are you not acting like a girl? Why are you not acting like a boy? And that is so complicated too, right? Because we can parse that out in terms of gender, we can parse that out in terms of identity. But, masking is protective, right? Like, masking exists because we are told, not just actually told, but society says you're supposed to act a certain way. And when you don't, you no longer fit in this mold of quote unquote normal development and moving through life in a neurotypical way. And again, it's just protective. And for trans people and people of color, unmasking can be a life and death situation. Like, there is a real risk here in unmasking. So I think it's really important to just think about why was masking going on? What were you protecting? And that's a good question to ask, of what are you protecting when you're masking? If you have to do something at work and you're masking, is it to protect your job? Is it to protect how your colleagues perceive you? Are you going to potentially be fired or demoted or not be offered that promotion because you do certain things? Like, there are so many ways that we could pick this apart. But at the end of the day, it comes back to protection, right? Like, we have to figure out a way to move through life where we're not bullied, discriminated against, potentially even inciting violence. That's why the rates of suicidality are so high. And they go up even higher when we start to put in place other intersectionality in life and society and identity, because again, that's just another barrier or obstacle or another stressor or another concern that you have to be concerned about, and another layer of protection that goes on top of that already foundational layer. So it makes complete sense why people who are autistic and ADHD, who have other forms of neurodivergence, have anxiety, have trauma, have depression, have hopelessness, have suicidality, because we're absorbing all of this simultaneously, but at the same time, society is piling it on top of us. And that's why it can feel so bleak so often. And it's nice to know that we can have groups like this where we can talk about this stuff without as much fear of repercussion.
Yeah, definitely. I think we can all relate to that, relate to masking and yeah. I guess if no one else has another question, I can keep asking questions. Or does anyone else have any more questions they want to ask? No. Oh, Griffin. Oh, you're muted.
I just now realized. So I guess the other question that comes to mind, Juliet mentioned this in your bio, which Patrick, I know you hate hearing your own bio. However, I think it's important to ask, what do you think the antidote to shame is, and why did you want to focus on reducing the stigma about shame? And could you also explore what shame is in case no one else who is watching knows what shame is?
Yeah, y'all are asking some complex questions. Shame is.
Sorry,
go ahead.
I was just gonna say, I think he means the shame and stigma around mental health.
Yeah, for sure. So there's a lot of shamefulness that comes up when we talk about our mental health struggles. If people don't like to disclose that they're struggling, and shame is a heavy, painful emotion that we experience, and it's probably one of the most painful, where we start to really get harsh criticism, inner criticism, perfectionism comes up, I'm not good enough comes up, embarrassment comes up. All of these things are really painful. And shame responses and shame spirals can be really devastating and really destructive. And I think that we as a society still have a lot of shame and stigma around mental health struggle and addiction struggle too, in general, because it's not looked at in a lot of ways to openly announce that you're struggling or having a hard time. It's more of the mentality of you don't share that stuff with other people. You kind of pull yourself up and do it on your own. You don't ask for help. There are lots of things that go into the stigmatization of mental health. And my goal all throughout my life has always been to talk about how I've been struggling or experiencing my day to day. And again, it comes back to a privileged place where I can do this openly without much repercussion. Yeah, there was risk of losing jobs at one point in time when I wasn't self-employed. But if I can talk about my day to day and what this looks like and give voice to something that other people either can't openly discuss for whatever reason, or just can't really put it out into the world in that way, I think that goes a long way. So I used to do this with my gambling addiction, where I would talk about day to day, like my struggles of having a gambling addiction. If we can normalize the fact that we are all human beings who struggle, we can reduce the shame and stigma around mental health. But there's still so much of it that exists. And even now we're moving into an era where people are more accepting of people going to therapy. I think we've all seen like therapy is dope memes and therapy is cool shirts and whatever else. And people will even tell their friends about their therapist. There is still a large population of people who don't believe in it, who feel like mental health is just a made up condition. We can't see it, so that means it's not real. There's so much shame and stigma that goes into mental health. And being able to talk about it openly is a way to kind of combat it. So having conversations like this is a way to combat whatever narrative exists about neurodiversity in general. Being able to talk about depression openly, or gambling, or whatever the case may be, active suicidality, it's a way to kind of allow people to know that it's okay to talk about this stuff. It does not have to control and paralyze you in terms of how you move through the world. But ultimately, what it does need to do is allow people to know that it's okay to struggle. We all know that everyone struggles, whether they want to openly admit it or not, and to lesser degrees, right? Some people are going to move through life without as many obstacles, but it exists regardless of that fact. And I think that that's been a big goal of mine throughout my entire adult life, is to just name it. And I think that also makes it less intimidating for other people to do so. Yeah, a social model is really the route that I would go, Leah, is instead of the medical model, where we're going to talk about like altering and changing behaviors that should not be altered and changed. I mean, and I'm not going to go down the rabbit hole of ABA therapy right now, but the social model and the social disability model, really important to take a look at. Losing my voice, but I'm going to make it.
I have a question. I know a lot of times once you realize that you are neurodivergent, you realize that like a lot of your family or friends are neurodivergent and they're probably not diagnosed. So I know probably in your practice, you probably have clients who you suspect may have a neurodivergence. How do you go about like bringing it up with them? I mean, it might be not easier, but like in a different scenario when you do it because you're a mental health professional. But like, do you have any tips for like trying to tell someone they're neurodivergent, or do you think that's not someone's place unless they're a professional?
It's a good question too. I mean, one thing I want to name is what you just said is so true. Like I've noticed most of my friend group is definitely neurodivergent. And I was like, oh, this makes a lot more sense why, we've kind of found each other. So I do want to name that because I think that's really important. And then you can start to look at your family's behavior and be like, oh, okay, now I'm starting to realize this as well. But that is a much more sensitive conversation for people with family dynamic stuff. So I don't go down that road with my family. I just witness it and watch it and acknowledge like, oh, now things start to make even more sense. As a therapist, I think it gets tricky. Like, one, I am not someone who likes to just throw diagnosis around because it can be so life-changing and life-altering, especially as someone who's been misdiagnosed multiple times in my life. I remember how damaging some of that was. But if I suspect that there is neurodivergence and we have a good relationship and rapport and someone's open to discussing it, the conversation is a lot more natural for it to come up and to talk about books that might be helpful or podcasts or YouTube channels and just, mentioning like there are a lot of similarities here. A lot of people want to know, like, why am I the way that I am, right? That's a question that a lot of people ask themselves and say out loud. And it can just be giving insight and psychoeducation, which I do think is a therapist's role at times. It's bizarre at this point in time because I have a podcast and my clients listen to my podcast and then they text me and are like, can we talk about what you said here and here in our next therapy appointment? I'm like, oh my God, this is getting bizarre. But nevertheless, I think if people want to open that door, we should go down it. But I don't like to do that without knowing that we have rapport and relationship built, because that can also be very damaging to the relationship if you just come out and say, hey, I think that you're autistic. And then someone's like, what the fuck do you mean by that? That's it's not a great tactful approach. So, but if you're saying more so in social situations, if you want to name it, I think it's worth talking about your own experiences, because again, coming back to disclosure, being the way into relationship for people who are neurodivergent, disclosing your own special interests, struggles, things that you experience, that can reduce so much vulnerability that exists. And that can allow people to drop in and be like, whoa, you're kind of describing my life. And then, that can lead to a conversation, right? But I'm just not one for like throwing diagnostic terminology all over the place, because there's so much overlap and there's so many people who just get it wrong, and getting it wrong can be very damaging.
Yeah, that's definitely true. I mean, a lot of neurodivergent people like to think we have like a radar for like other neurodivergent people, but like I think it just stays at that, other neurodivergent people, because we can't necessarily say like oh, this person is definitely autistic. It's like, well, I'm not a mental health professional, so I can't really like say that they actually are. But like neurodivergent, I think I can kind of say, like, I'm not gonna say it to them, but like, you know, it's a radar you have.
Oh yeah, I
But
think there's definitely a radar. I think that people who are neurodivergent are very intuitive. We are very empathic. We're picking up, and that's because we're also tracking things constantly, right? Like picking up on body language, posture, facial expressions, trying as hard as we can to like either pay attention to a conversation, make eye contact, observe the room. Like we have to do so much to be social. So I think we really are empathic in terms of picking up on energy, which is on the other side of the coin, really exhausting and really depleting. And that is what can create burnout and crash too. But I think you're right. I mean, I think we are very intuitive about people who are neurodivergent, and we might see other traits and characteristics of ourselves and other people. And that is something to check ourselves on sometimes too, when we're like overly eager to be like, oh my God, I do A, B, and C. So that means you are A, B, and C. And that is something I try to stay away from, because I want people to label and define and diagnose themselves as they want to and identify the way they want to. So I like person's first language, or I'm sorry, identity first language, but I want to honor what people want in terms of how they like to also identify themselves. So this is very nuanced, you know, and it's such a good conversation to have because it opens up all of these different doors to pay attention to.
Mhm. Yeah, definitely. And does anyone else have any questions they want to ask? Comments? You can use the chat if you want, if you don't feel comfortable speaking up. I know I always use the chat in Zooms. Oh, Griffin.
Sorry about that. I always manage to do that last minute somehow. I will say you brought up an interesting word of vulnerability, and so as someone who I don't know, would you use, in terms of vulnerability, you mentioned about people not needing to mask, like it's important to be your complete authentic self. However, for me personally, I am not as open as I used to be in the past. And for me, that level of vulnerability is only with, people that I trust, that, hear my monotone voice or know what I go through on a daily basis and so forth. So, where do you find that balance as an autistic or someone who is autistic that is trying to establish friendships and connections with people while also being their self, but also, not being so open? Because I do think for me, if I were to open completely about my past to some stranger or acquaintance, I think that would be very difficult to try to establish a friendship. But it's not a medical question, but rather I just want to hear your thoughts about having that connection with people and where you find that balance between vulnerability, wanting to be open, and stuff like that.
Yeah, I think vulnerability is important, but I also think we have to pick and choose our moments. There aren't always going to be appropriate times to disclose every single part of your life to someone you've never met before, because it can lead to repercussion. But ultimately, being able to be authentically you is really a way to kind of honor how you move through the world without having to censor yourself or safeguard yourself in every single turn. But that doesn't mean it can be something that you can do in all situations of life. I mean, you do have to pick and choose the relationships where you feel like, okay, I feel comfortable enough to do this, and I feel like in this work setting I have a good enough relationship with so and so. So I think that is also important. Sorry, I'm just trying to read this chat message simultaneously. So I think that it's really important to kind of name, like, this cannot be all the time, right? Like, you can't just drop in and feel safe in every situation. I mean, our trauma histories are not going to allow us to do that. But if you have a good enough relationship with your therapist, great spot to be vulnerable. You have a good enough relationship with some friend groups or some colleagues or some, or a partner, great spot to be vulnerable. I typically don't go into social situations very vulnerable at all. I'm kind of reading the room. I kind of feel apprehensive about socializing. I can look like I don't want to be there. Sometimes I don't want to be there, and I will show it on my face. But I do think it takes a lot of like learning about yourself and some healing work too. And I do think that when we are able to do it, it feels really freeing, but also knowing that we can't always just drop that and that we do have to protect ourselves.
No, I appreciate your answer. I just thought it was something that I wanted to ask quickly before we moved on to other questions about vulnerability, establishing connection with people, being your authentic self, and when to do that. I think that's important. I think, again, for me, not everyone gets to see my complete self, but I do think it's important that and emphasize that some people don't speak in monotone, for example, but that doesn't mean that they're not their authentic self. That I do embrace my autistic identity. So, but no, I appreciate your answer and your thought about vulnerability. So I appreciate that. Thank you.
Yeah, absolutely. And you being monotone, right? Like that is your authentic self probably. And like, I know that I went to a psychologist a couple of years ago when I was going through this process, and I had never even met this person, and she was like, "You're autistic, aren't you?" And I was like, "Whoa, like I'm here to get evaluated for ADHD," and kind of caught me off guard. So I didn't know how to respond to that. But I am flat a lot of the time. I am monotone a lot of the time. Like I have a pretty level voice, which people therapeutically would say is very helpful. But, I do think that is also my way of just at this point in time in my life accepting who I am. Like if you listen to my podcast, I don't talk much differently than I'm talking right now. I still mask in some situations, right? Like if I see someone laughing or see someone head nodding or whatever, I'm like, oh, I need to do that too, right? Like I need to match this, especially in loud environments where like people are talking to me and I'm just like, okay, if this person's laughing, you need to laugh. If this person's like doing this thing, you need to do this thing. So, adaptation and survival mechanism, basically. Do I work with older clients who are neurodiverse, 50 plus, or know anyone that does? I don't really see therapy clients that much anymore because of my other businesses, but I can probably figure out some resources for sure in your area if that's what you're asking. So Juliet might be able to bridge that connection. And I will say this for everyone of you that is listening, right? Like if you are neurodivergent, having a therapist who understands neurodivergence is so crucial, because what can happen is you can be shamed from the get-go. You can be dismissed. You may be told not to stay. You may be told to stay on track, not jump around, make eye contact. Like I never make eye contact. I'm doing it right now because I'm like very well versed at being in meetings and doing that. But like usually I'm all over the place. I'll turn my video off. I'll be on my phone or doing something because that helps me pay attention. But having a therapist who is very affirmative in terms of neurodivergence, really crucial. And you should ask those questions when you call. You should ask those questions and feel like you're able to, because there's nothing worse than getting there and then completely being yourself and being told to act differently or being referred out for that reason. It can be really painful to experience. Talk about rejection sensitive dysphoria coming up. Like that can really create some rejection sense. Yeah. Eye contact on Zoom does make looking at the camera, and then I'm like, now I feel even more bizarre that I'm doing this because I'm like, I can sense everything else around me and I want to be looking at people who are talking. It's something else.
I will say too that I'm not a fan of eye contact, but anytime in a social situation, I do like people that have like unibrows. That way I can just like stare right at their unibrow and not make eye contact, but it looks like I'm making eye contact. So that's a good strategy. I think it is a good strategy, is what I've been taught. But it's I think it's always important to understand that, hey, just because I'm not making eye contact does not mean I'm not interested. It's just how my brain is. And so I hope that sources like these, anyone that's listening, or people will have the opportunity to say, all right, I need a better understanding of neurodiversity. And so I'm glad we're having this meeting. And I appreciate you bringing up eye contact.
Yeah, eye contact is not for me. What I can say though is now that I have learned so much about who I am, I mean, I know everyone can't do this, and I'll also acknowledge that, but I just name it. Like in Zoom meetings, if I'm recording with someone on my podcast, if I'm, doing therapy with my therapist, I'm like, I'm not going to look at you. And it has nothing to do with me not respecting you. It's just more so that's how I can pay attention and actually stay grounded in this conversation. And, before then you're like internally telling yourself, you have to do this, you have to do this, you have to do this. And that just takes a tremendous amount of energy to do that 24/7.
Yeah. I want to be cognizant of your time because I know we went over by a few minutes. But I just want to say thank you so much for coming to talk with us. I think it was a really valuable talk, and it was a really great discussion.
Yeah, thank you very much for having me on here. And I appreciate all of you that showed up and that you're asking questions. And I really respect the hell out of that. So thank you for that.
Right. Goodbye, everyone.
See y'all
Have
later.
a good rest of your all day. See ya.
See you.